Hello, my name is Jada Mathis, and I am from JSU's Department of Nursing Graduate Studies. Today, we will be discussing the importance of mental health screening for LGBTQ youth. 8%, that is 1.3 million American high school students report being lesbian, gay, or bisexual. 4.2% were not sure of their sexual identity. This staggering number does not even account for those who identify as transgender or who are too afraid to report their sexual orientation or identity. The majority of these kids are ignored at best, bullied and discriminated against at worst. These kids most often lack the support system of their families, religious institution, and friends. According to the Human Rights Campaign, only 25% of LGBTQ youth have supportive families. 78% of LGBTQ youth are not out to their families out of fear because they have heard their families make outright negative comments about gay people. The lack of support system leads these ill-equipped adolescents to cope on their own with immature coping mechanisms, often leading to isolation, risky behavior, and poor relationship choices as they try to navigate awareness and identity on their own. The efforts of the CDC and their Youth Risk Behavior Study, data is finally available for this little-known but prevalent vulnerable population. Nearly 18% of lesbian, gay, and bisexual students reported having been raped at some point in their lives. This is more than 3 times the rate of their straight students. These kids were twice as likely to be bullied, both online and on school property. They were also more than twice as likely to stay home from school to avoid violence from classmates. Almost 30% of these kids had attempted suicide in the past year, which is more than 4 times the rate for their peers. And 63% of LGBTQ youth reported feeling sad or hopeless in the last year, compared with 27% of heterosexual respondents. They also reported using hard drugs far more often. 6% reported using heroin at least once, and 5% reported injecting a drug intravenously, which was 4 and 5 times the rate among straight kids, respectively. Up to 25% of LGBTQ youth reported having binged, purged, or fasted regularly. Furthermore, according to a report published by the National Gay and Lesbian Task Force, as many as 42% of the estimated 1.6 million homeless youth in the U.S. identify as LGBTQ. The nurse is to educate and empower, often being the one advocate these kids have when they come out. The American Psychiatric Association voted to remove homosexuality from the Diagnostic and Statistical Manual of Mental Disorders in 1973, but the effects of decades of pathologizing being gay has continued to persist for decades. The public health nurse may have a vital role in researching this population and educating society, dismantling stigma, and halting discrimination. The APHN will play a vital role in education, advocacy, and connecting vulnerable kids to resources available to them in this delicate time of their development. The more vocal healthcare workers will become to recant previous assumptions regarding LGBTQ people, the less power that stigma will hold against this population. Reversing stigma takes courage, but such courage is necessary of anyone who desires to be a change agent in society. Evidence shows that LGBTQ high schoolers who reported being able to talk to an adult in the school had fewer suicide attempts, lower rates of being threatened in school, and less injected drug use. Furthermore, it was shown that kids who attended a high school with gay-straight alliances correlated to less bullying and fewer suicide attempts. Schools that included queer-specific information in the sex education curriculum also reduced several risk factors, including STIs. When specifically discussing harmful legislation, I must mention the no promo homo laws still in place in many U.S. states, Alabama being included. These laws foster an unsafe and unwelcoming school atmosphere. They explicitly forbid teachers of health, sexuality education from discussing LGBTQ people or topics in a positive light. Not only can they not discuss it in a positive light, but these teachers are also more likely to teach it in a negative way. Furthermore, LGBTQ youth in the no promo homo states are less able to access relevant school health information and services. In Alabama, in terms of sexual health education, the law states that classes must emphasize in a factual manner and from a public health perspective that homosexuality is not a lifestyle acceptable to the general public and that homosexual conduct is a criminal offense under the laws of the state. Alabama State Code 1640A2C8. As of March 19th, 2019, this law is currently in legislative process to potentially be overturned. Action, assessment, and linkage with treatment can have significant impact on mental health outcomes and child health and well-being. President Barack Obama's new Freedom Commission on Mental Health highlights that quality screening and early intervention should occur in readily accessible, low-stigma settings such as primary health care facilities and schools. Schools are where more than 55 million children and adolescents can readily be found every day, presenting the opportunity to reach, screen, and intervene with large numbers of children. It is estimated that school nurses spend 33% of their time counseling with students on mental health issues. A plethora of tertiary nursing strategies that the nurse can exercise, such as active listening, therapeutic communication, teaching the victim of bullying skill building and conflict and anger management, effective coping strategies and problem solving, social skills training, cognitive behavioral interventions, relaxation techniques such as guided imagery or deep breathing. School nurses are also very knowledgeable in grieving process and can intervene when a student has experienced any form of loss. Also, the school nurse is very knowledgeable with how to make referrals, such as individual counseling, family counseling, to resources such as PFLAG, which is an acronym for Parents and Friends of Lesbians and Gays. That's an organization with chapters all over the nation that provides family services. They could also refer the family to affirming local churches from different denominations and religious affiliations, and potentially to a physician if medical treatment is necessary. Also, studies should suggest that school-based LGBTQ anti-bullying workshops are very promising, and that when these workshops are posed for students and for professional development for teachers, that this does provide a better climate for these students, and results in better tolerance and acceptance among straight peers. To discuss the cost of screening, we must discuss the cost of the problem. Mental health disorders among children are an important public health issue in the U.S. because of their prevalence, early onset, and impact, with an estimated total annual cost of $247 billion. But the cost of screening is basically the time and attention of a compassionate nurse. It is simply performing the nursing process of assessing and screening, then planning and intervening. The effectiveness cannot be overstated. According to the American Academy of Pediatrics, health disparities are greatly reduced if the youth are screened, identified, and able to then talk openly to a safe adult, such as a compassionate and capable health care provider. Discussed, screening for mental health concerns can occur at the school-wide level. School-wide screening focuses on the presence of risk indicators such as disciplinary referrals or absences within the school context. Schools, however, experience challenges with universal screening, such as concerns that it will detract from instructional time, lack of acceptability by parents, teachers, and administration, potential legal questions such as district policies, state laws, and ethical concerns, such as does the school have the resources to follow up with the students identified at risk? Despite these potential barriers, intentional mental health screening increases the likelihood of identifying students who otherwise might not be found, increases the likelihood the student will accept professional treatment, and reduces the potential for exacerbated risk. Given the school nurse role in universal screening for other healthcare concerns such as vision or hearing, nurses are in a position to be a part of the coordination of school-wide universal screening for mental health concerns. In conclusion, LGBTQ youth are a vulnerable population in the U.S. and often find themselves helpless to fight for themselves. Mental illness, homelessness, and dangerous bullying are some of the issues affecting these kids, but much of the depression, isolation, and emotional pain can be greatly reduced with the establishment of a safe space and community with supportive peers, mentors, and healthcare workers. Thank you very much.